Good morning. Today we are discussing about pathogenesis of periodontal pocket. So we should have an understanding about the basic structures of periodontium before going to periodontal pocket. So you can see here, you can see longitudinal section of gingiva showing free gingiva, attached gingiva, as well as alveolar mucosa. Free gingiva, otherwise called marginal gingiva, it is that part of gingiva that is not attached to tooth, that can be separated from the tooth by a probe. Then free gingiva then continues the attached gingiva, whereas in between you can see a free gingival groove, which is a clear demarcation between free gingiva as well as attached gingiva. Attached gingiva, or the fixed portion of gingiva, it is that part of gingiva that is attached to underlying bone. Then in this picture, you can see mucogingival junction. This is the junction between gingiva as well as the mucosa. Then what we have here is gingival sulcus, or otherwise called gingival crevice. This is a V-shaped sulcus or V-shaped groove surrounding each tooth. Going to the histopathological aspect of gingiva, gingiva has got a epithelium as well as underlying connective tissue. Gingival epithelium has got a sulcular epithelium. It has got a junctional epithelium as well as it has got an outer gingival epithelium. Junctional epithelium is that part of gingiva or gingival epithelium that is getting attached to tooth, or it is that part of gingiva that is getting attached to tooth. This is junctional epithelium. Here, what we have is sulcular epithelium. The epithelium, gingival epithelium lining the sulcus is sulcular epithelium. What we have here in the outer portion of gingiva, from the gingival crest, then from the gingival crest to the outer area of gingiva, or in the outer aspect of gingiva, we have outer gingival epithelium. This is outer gingival epithelium. And this portion is gingival connective tissue, which is rich in blood vessels, lymphatics, as well as the ground substance. Then beneath the gingival connective tissue, we have the periodontal ligament fibers as well as alveolar bone. Coming to the gingival connective tissue, so we have already mentioned that gingival connective tissue has got a ground substance, it has got cells, it has got fibers, and the blood vessels and lymphatics, nerves, everything embedded within the ground substance. So here the gingival fibers, dentogingival fibers, alveolo-gingival fibers, dentoperiosteal fibers, circular fibers. These are the gingival fibers shown here. These gingival fibers has got an important role in attaching the gingiva to tooth surface. So all these gingival fibers are seen just below the junctional epithelium. This is the junctional epithelium. It is through the junctional epithelium, the gingiva is getting attached to tooth. This is the epithelial portion of attachment, and this is the connective tissue portion of gingival attachment. Now, this is gingival crevice. We mentioned that this is a V-shaped groove, or this is a sulcus area. So this region is the junction between a hard tissue surface as well as a soft tissue surface. So what happens in this area? Whenever there is microbial plaque or a microbial challenge. So look here, in the presence of microbial plaque or a microbial accumulation in the gingival sulcus area, the underlying gingival tissues, they respond profoundly to any kind of such irritation. The microbial accumulation is very common, or it easily occurs in this area because it is a soft tissue, hard tissue junction. This area is difficult to maintain, as well as the microbes, they favor this area. They favor this area as this area is not easily maintainable. Apart from that, they obtain their nourishment easily from gingival crevicular fluid, from the gingival sulcus as well as from the saliva. So this is the area where they prefer. The microbes, they prefer this region. So plaque and calculus are more commonly seen in this region. So the presence of any such foreign challenge or microbial challenge in this region easily stimulate underlying gingival tissues. The gingiva has got defense mechanisms. It has got numerous mechanisms by which it can detect even a minor microbial irritation in this area. So what happens to this gingival epithelium and gingival connective tissue in this area in response to such a plaque accumulation? So we know, we have seen that gingiva has got a profound defense mechanism. So how is this defense mainly acting? It is through the neutrophils. So this is gingival connective tissue and these are the gingival epithelial cells. So gingival connective tissue has got blood vessels within it. It has got numerous blood vessels within it and the neutrophils are seen within the gingival blood vessels. It has been found out that these neutrophils, they constantly migrate from this gingival connective tissue into the gingival crevice in between the gingival epithelial cells. Constantly, these granulocytes, they migrate through the gaps between these epithelial cells into the gingival sulcus. They inspect this gingival sulcus area for any kind of irritation. So whenever there occurs an increase in amount of plaque accumulation in this sulcular area, or whenever there is a change in the quality of microbial plaque in this region, there occurs an increase in migration of these neutrophils from the gingival connective tissue to the gingival sulcus. So then what happens? So then what happens whenever there is a microbial challenge? There occurs an increase in amount of cells. We saw an increase in amount of granulocytic migration across the gingival epithelium to the sulcus. Along with that, there occurs an increase in the amount of inflammatory fluid. So gradually, gingival crevicular fluid gradually transforms from a transudate into an exudate. Along with that, we saw numerous connective tissue collagen fibers within the gingival connective tissue. There occurs destruction of these connective tissue fibers either due to the enzymes released from the microbes or due to enzymes called collagenases. They are matrix metalloproteinases. They come under this matrix metalloproteinases, MMPs. These enzymes are released from fibroblasts, from neutrophils, as well as from macrophages. They destroy these collagen fibers that are seen just apical to junctional epithelium. The fibroblast, apart from releasing collagenases, they will also phagocytose the collagen fibers. So, due to the increase in the amount of neutrophils migrating to along with the increase in migration of neutrophils to the sulcus area, apart from the release of enzymes in the gingival connective tissue area, there occurs destruction of gingival connective tissue fibers. Along with that, there occurs loss of cohesiveness of gingival epithelial cells within the gingival epithelium, mainly within the junctional epithelial zone in this region. The gingival, these neutrophils that are present within the blood vessels of connective tissue, they migrate through this junctional epithelium into the sulcus. So with the increase in migration of these cells, there occurs a loss of cohesiveness within the junctional epithelial cells. This loss of cohesiveness will gradually result in detachment of this apical portion of detachment of coronal portion of gingival junctional epithelium, and the apical portion of junctional epithelium gradually migrate. It produces certain extensions, finger-like extensions to the underlying tooth structure in order to maintain attachment. along with that, the coronal portion of junctional epithelium detaches. So what happens when the coronal portion of junctional epithelium detaches? There occurs an increase in the depth of gingival sulcus, thereby producing a periodontal pocket. So these are the inflammatory changes that you can see within a gingival connective tissue whenever there is a profound microbial challenge. So the coronal portion of junctional epithelium thus detaches from the root. The neutrophils gradually invade the coronal end. The tissue loses its cohesiveness. It detaches from the tooth surface, and there occurs an increase in the depth of gingival sulcus, thereby transforming the gingival sulcus into a periodontal pocket. So this is how a periodontal pocket develops from a gingival sulcus. So it is a pathologically deepened gingival sulcus. So periodontal pocket is a very common feature seen in periodontal disease. So before planning treatment of a patient with periodontal disease, we should have a clear understanding about the basic structures of periodontium, as well as how the periodontal pocket has developed in this particular area. So that is about the development of periodontal pocket. Thank you.